Hello, my name is Trisha Harms. I am a student in the doctoral program at Morningside University. Today I will be discussing the statistical analysis of a study that collected data regarding interventions to decrease hyperlipidemia. This is for class 920 for Dr. Brenda Weimer, and today is November 29th, 2022. A problem currently in the United States and throughout Europe is that there are more than 3 million adults who have been diagnosed with hyperlipidemia. While this is increasing every day, it is also a preventable issue. What is hyperlipidemia? It is a medical term that refers to a high level of fat circulating in the blood. Possible interventions to reduce hyperlipidemia are medications, modifications to diet, and lifestyle. The goal is to ultimately reduce the risk for cardiac events such as a heart attack. The demographics of this study consist of men and women who have been diagnosed with hyperlipidemia, with the ages ranging from 40 to 89 years of age. The individuals were monitored over the span of a year. The data that was collected pertained to the patient's cholesterol level at baseline, 6 months and 12 months, age, sex, educational level, support person, and use of medication. The PCAT question that I determined for this study was, do adults 40 years old and older with hyperlipidemia have a better outcome when started on a statin and have a support person present in appointments compared to those who do not take a statin or do not have a support person over a 1 year span? The statistical program that was used to evaluate the data obtained for this study was the Statistical Package for Social Sciences, also known as SPSS. For the analysis of this data, there were several tests that were completed. Those tests include descriptive analysis, frequencies, pair t-tests, tests of normality, which included the Kolmogorov-Smirnov, and Shapiro-Wilk. Variables used, like stated in the other slide, were age, gender, cholesterol level, education, support, and medication. When looking at the age analysis of this group, it was found that the mean age was 60.84 years of age, median was 60 years of age, and mode was 49. The histogram in Figure 1 does show a symmetrical curve with no major outliers. On this slide, you can see the results from a t-test that was performed on the data. The data used for this test was the cholesterol levels at baseline and 1 year after intervention. A paired t-test is a statistical test that's used to determine the difference between the paired observations. Here you can see there is a statistical significance in the baseline data when compared to 1 year after intervention. Here is another analysis using the t-test to compare data. Here the variables are different from before. This one pertains to cholesterol level at 1 year and intervention. If there was a medication, the intervention would either be if there was a medication used or if there was a support person, or neither. Here on this slide, there is another analysis that was completed, which is the Kolmogorov-Smirnov and Shapiro-Wilk test. These tests are used to determine the normality of distribution of continuous variables. This test also showed statistical significance with variables of medication use and support person. Differences noted throughout the study. There actually was no significant difference in the educational level or educational background when comparing the baseline to post-baseline cholesterol levels. There was 46% of individuals in the study who actually had 12 years of education noted. Of the 50 participants, 58% were male and 42% were female. However, there was no statistical difference when comparing the gender to decrease in cholesterol levels at 12 months either. Again, on this slide, you can see about that about half of the participants did have support while the other half did not. There was also 58% of the participants that were started on a medication. While there is no statistical significance between the use of a medication and a support person, it is highly beneficial and recommended for individuals to start a statin in addition to diet modification and exercise when diagnosed with hyperlipidemia to prevent cardiac events. Lastly, the recommendations from this analysis of the study are educating healthcare professionals that individuals who do have a support person available during visits may provide better health outcomes. Educating patients about the importance of having a good, strong support system will help them be set up for success as well. Lastly, informing healthcare professionals that it truly does take a village to improve patients' health, making sure the providers are incorporating other resources to ensure the patient is set up for success. Lastly, I'd like to thank you for listening to my presentation, and here is a list of my references. If you have any questions about the presentation or the analysis that was performed, please reach out. Thank you.